Hi there, my name is Ariana Stark, LPN, and I'm an Indiana State University student in the LPN to BSN program. This is my health education program on motor vehicle accidents. Motor vehicle accidents can range from accidents with minor injuries to accidents with very serious injuries. If these severe injuries occur, you will most often need emergency services at the scene of the accident, and you may need to be taken to the emergency room where you will receive health services from doctors, nurses, and other healthcare professionals. Some causes of motor vehicle accidents include illegal substance and alcohol use, poor weather conditions that make it more difficult to control your vehicle and more difficult to see while driving, a person falling asleep because they were driving while tired, a person operating their vehicle at high speeds, and distracted driving. Chances of injury increase for somebody in a motor vehicle accident when they are sitting in the front seat, if they are not wearing a seatbelt, if the person is thrown from the motor vehicle, or if the person is hit by another vehicle. Main injuries that somebody sustains from a motor vehicle accident include pain and soreness from cuts, bruises, and other wounds. Some major injuries such as bleeding, which can be life-threatening, broken bones, and paralysis due to nerve damage. A person may exhibit shock from blood loss, which symptoms include a feeling of being cold, faint, dizzy, or excessively tired. A person may exhibit difficulty breathing. And a person may also sustain a head injury, which can cause throwing up, a headache, confusion, a feeling of disorientation, or the person with a head injury may become non-responsive. There is some diagnostic testing that a person will undergo when they are in a motor vehicle accident and are taken to the emergency room. This includes blood and urine lab testing, X-rays, CTs, MRIs, and ultrasound scans. These scans will be able to tell medical professionals if there are any broken bones, internal hemorrhaging, and other serious medical illnesses and injuries. Secondary problems related to a motor vehicle accident include infections due to germs entering through breaks in the skin, either from the accident or from surgery. And these infections will slow the healing process. Secondary blood clots, which cause pain and can block blood flow to the heart, also known as a myocardial infarction, to the lungs, which is also called a pulmonary embolism, or the brain, which is considered a stroke. These can be life-threatening. A person may also have mental and emotional residual effects from changes in behavior and functionality, which will make it difficult for that person to cope. A person may also suffer from post-traumatic stress disorder from the accident itself. Medical professionals, primarily the doctors, will prescribe different medications to help a person post-motor vehicle accident. This includes medications to control pain and swelling, medications that will help control muscle spasms, medications to control, decrease, or support nerve functionality when a patient has nerve damage, medications that prevent and help fight infection, and blood thinners to help prevent blood clots. A person after a motor vehicle accident may suffer from long-term health problems. These long-term health problems include chronic pain, mood instability, chronic low blood pressure, reoccurring infections, blood clots, long-term disability, as well as mental and emotional problems such as PTSD, like we spoke about on one of the previous slides. How to prevent motor vehicle accident injuries. So these are ways that you can mitigate serious injuries if you were to be in a motor vehicle accident. These methods include: always wear your seatbelt, drive safely, obey the speed limit, and do not drink and drive. Primarily, you are focusing on operating your motor vehicle as safely as you can. Do not allow children younger than 13 to ride in the front seat. If you are the driver, you should sit 10 to 12 inches away from the steering wheel, and passengers should sit as far back from the dash as possible. Motor vehicle accident injury prevention continued. Children should ride in the appropriate seat for their age, such as babies should be rear-facing as long as possible, and children should remain in boosters until they reach the appropriate parameters to sit in the seats of the vehicle. You should avoid distractions while driving, such as do not text and drive and using hands-free devices only. You should take breaks and implement rest periods to avoid drowsy driving, and take extra care in inclement driving conditions, such as lowering your speed in rain, snow, traffic, and late night driving, and always ensuring that you have adequate and appropriate following distance. Some education on motor vehicle accidents can be found at Premier Health through the Miami Valley Hospital Driver Safety Program. Montgomery County also has a Safe Communities Coalition. There is also a program called Drive Alive. It's an interactive program to educate teens on driving, which includes small group discussions, simulated trauma responses by EMS teams and medical professionals, sessions with the Miami Valley Hospital chaplain, survival testimonials, and an interactive video called Make the Right Choice. There are phone numbers for both of these programs and a link to other emergency and trauma detection and prevention programs through Miami Valley Hospital. The CDC Motor and Vehicle Safety link for recommended guidelines by the CDC is also included on this slide. And the National Institute of General Medical Sciences also provides an education fact sheet on motor vehicle trauma. Thank you for the time to listen to my health education program, and have a great day. Thank you.